I'm David Foote. I'm the CEO of Xenia. Xenia is one of the fastest growing technology startups in the Philippines in general, but also one of the fastest growing healthcare startups. We're a San Francisco company that began our first operations here in the Philippines. Our target was to launch the Philippines first and then move on to other countries. One of the questions I answer the most frequently is why Philippines, right? When I'm talking to investors in the US or investors other places, they say, why this place? Part of the reasons I had 18 years living here, so I had a lay of the land. But also, I think the Philippines has a lot of very interesting and deep problems in healthcare that make them interesting challenges for us to solve. And also, coming from the perspective of the US, I think it's a better place for us to solve healthcare issues than the US because it's not necessarily an insurance-driven market. It is a consumer-driven and a government-driven market that allows us more opportunities to innovate truly by focusing on customer needs. So I'm going to begin my presentation talking a little bit about some of the challenges and problems that are sort of unique to the Philippines, and then why that creates an interesting opportunity for us. So the average human walking speed is 5 kilometers per hour, right? What's interesting is the Manila traffic averages 4.88 kilometers per hour, right? It's actually faster to walk than to drive here. Now, from a healthcare perspective, think about the friction that this creates, just for a general checkup or to go see a doctor, but even worse for people who are involved in chronic illnesses like diabetics or people who are stoma patients or wound care patients, right? It's very difficult to go back and forth to hospitals and clinics. So, other challenges. 70% of all medical specialists live in Manila, and this is a unique geographical challenge in the Philippines. Because of the island structure, it's very difficult to get a concentration of the right healthcare workers throughout the country. And I don't believe that's ever going to change. I don't think no matter what you pay a high-end medical specialist, they're not going to want to go move to the jungle. So, I think technology really has an opportunity to help solve these kind of problems, to bring health remote that you can't currently service. Right? 30% of all drugs here are counterfeit. And this is actually a surprise to me. I've learned this as I've worked with the pharmaceuticals here. This exists everywhere. It's in the hospitals, in the clinics. Counterfeit drugs are a major problem in the Philippines, and this is another area where we have technology solutions around blockchain. 30% of lab results are inaccurate, and this comes from the laboratories themselves. This is because of the paper process where when you do a blood test, someone writes what your blood test is on a piece of paper, someone types it in, someone brings it back. That introduces opportunities for error, which creates problems. So, another thing to talk about is malnutrition in the Philippines. And this was a surprise to me after I started Xenia. 33% of all children in the Philippines are growth stunted. It's a protein malnutrition problem, right? So, it's a unique kind of malnutrition where they are eating enough food, but not enough protein. And what we believe is happening here, and the reason why we believe this is happening, is that countries of similar economic indexes fare much better in this area than the Philippines does. I don't think it's a money issue, I think it's an education issue. People here at certain socioeconomic levels believe that rice is food, right? And so given a constrained budget, like if you're a minimum wage worker in the Philippines making 10,000 pesos a month, you have to make some difficult decisions about how to spend your money. If you don't understand nutrition, you're not going to spend it correctly. Now look at this other statistic. 63% of all mothers here are single mothers, right? So we have a problem here. The average single mother has 3 or 4 children, has to provide for them, has to find a way to work, and the ratio of jobs for men to women is 5 to 3. So the majority of the family needs are managed by mothers who don't have as many job opportunities as the men in this country and then have to find a way to feed their kids. So it's a serious social epidemic. So the problems I believe in healthcare in the Philippines are problems of access that we discussed, problems of education around knowing what to care for, what to look at. And I think, the Healthway mentioned quite properly, a lot of people don't necessarily know how to check for their own cholesterol levels or so on. Problems of quality and then cost. Our approach with Xenia is to take a technology-first, a mobile-first approach at this, and we think that the future of healthcare is increasing access, increasing education by being able to go out to customers at their homes and to go out to regions remotely using mobile devices. We've gone through, and a lot of people the other question that actually people have asked me aside from why Philippines is, why massage and why wellness? Why didn't you jump straight into healthcare? This is because I believe the future of healthcare merges wellness, that as we take healthcare from being a reactive sort of activity to proactive, we have to educate customers. To educate customers, we have to build trust and get in there with services that are similar and then build up. It's very difficult to market an app to people for blood tests because they don't do blood tests very often. But if you're already in front of them every day, you can upsell them and start to educate them, and that was our model. Right? What we're creating is a full stack health service, and this is often misunderstood. It's not just an app. We're integrated with several of the top laboratories here. We're integrated with the pharmaceuticals around blockchain to be able to move products from point A to point B. We have some of the only direct integration with the laboratories of anybody here, meaning that if we send a nurse to you to draw blood, they scan that vial, and then that blood, that same vial goes back to the laboratories and is scanned again with no human interaction. There's no paper process, there's no error. Everything goes from point A to point B because we built a platform for this. What you see here is, those are actually my blood tests, my blood results, which I've got some cholesterol issues you can probably see. but that's in the app. So that comes in within hours or the next day automatically after we send a nurse to go pull the blood. We have HIPAA-compliant medical records. We have HIPAA-compliant chat where you're able to talk with doctors and nurses. We have ability to do screening for various conditions. And we have health monitors around vitals connecting to Apple Watch and other wearables. Part of what you see at the bottom of the screen are part of the future, we believe, is connecting to devices, and we have this today, like Bluetooth stethoscopes, Bluetooth otoscopes, Bluetooth ultrasounds, so that someone on site, like a mobile health care worker, could be a midwife, could be a nurse, is able to do primary diagnostics that then goes back to a doctor who remotely is able to perform diagnosis. So, showing you a little bit about, we do over 1,000 services per day right now, and actually that's a typo, more than 400,000 services performed. What you're seeing here, this is sort of a real-time view on an average weekday. In blue, those are motorcycles. In orange, also motorcycles. In green, those are providers and job. There's nurses, there's therapists. So we have an entire network of supply chain moving around. We've got just-in-time delivery. We've got cold chain logistics. We have nurses and therapists moving around serving jobs, and this is happening every night and every day. A big component for us around healthcare is training, right? And we're talking about not just training for the therapists, but also for the nurses, training them around diabetic care specialization, training them around stomach care specialization. So we've developed technology to automate training. We do more than 3,000 hours a month of training with no HR, with no admin. Everything is automated through mobile devices, both a combination of online training and offline training, right? What you see, that green thing is an IoT automated device. So what we're able to do is track the actual location of the trainee in the room when they're getting training, and then they mark their attendance or kick them out of class if they're not there. All automated. All right? So showing a little bit about the back end, we have, these are some of our IoT kits. We have temperature-controlled kits for blood testing, for vaccinations. We have kits for Bluetooth temperature, Bluetooth blood pressure, body fat composition scales, and we have an entire end-to-end chain that involves centrifuges and blood storage and vaccination storage to be able to work with hospitals and clinics and partners, right? And this shows a little bit of the training. We think that a big part of the future here, moving sort of some of healthcare, and by the way, I want to be very clear because I know we've got clinical partners here and so on. We believe in continuity of care. We're not thinking that this replaces clinics, this augments these clinics, right? We're able to take some healthcare to the home and then push back to doctors who are in clinics. We're able to follow up with a blood test that a doctor requires at a clinic to then do it at home. One of our partners also here, MaxiCare, we're working with them on rabies vaccination and blood testing, right? The first rabies shot will be performed at the hospital, the next 4 by us. We're MaxiCare is the payer. And we've done complete integration with their back-end system. So from the customer standpoint, all you do is book, right? It's paid for, it's taken care of, all the paperwork is done. So going back to some of the challenges in healthcare, the 98% of Filipinos have Facebook, and there's actually almost nearly complete smartphone saturation. We think that part of the key to being able to go out there and pull people in and educate them is to really go through mobile first. Mobile first on the client side, but also mobile first on the provider side, where we create free medical record systems for hospitals and clinics so that doctors and clinics around the country can engage in healthcare with the clients, right? So I'm not going to go too much of this. This is just to give a sense. Behind the scenes, behind all the application infrastructure you see here, there's big data, and there's machine learning, and there's AI and payment systems. You know, with 1,000 transactions a day we do all credit card and PayPal and so on. We have just-in-time logistics, we have inventory management. The whole goal is we built the therapeutic massage business on purpose just to create volume of services that we could then use to create the technology. And to give you a sense of how that worked, in the US, there's a company called Foote that raised $40 million. They launched in 35 cities in the US, right? We actually do more jobs than they do in one city, in Manila, right? So the opportunity here, because of the cost of labor, because of the challenges here, was so great that we were able to do much more value and build much more technology than competitors in the US. We think that the future of healthcare is a combination of online and offline, hospitals and clinics for certain things, home for other things. We think there's a greenfield opportunity. We think that there's a big opportunity here to create additional awareness and consumerize products. You know, if you look in the US, you have companies like For Hims and For Hers and Roman, which are selling products that people don't even know about. I mean, part of the problem with today's healthcare is it's very reactive, and it doesn't create opportunities. My own hair is thinning a little bit, and started thinning probably when I was 35. I had no idea about finasteride and minoxidil. I didn't know. When I saw the doctor, he said, "Oh, you should have come in years ago and asked for finasteride and minoxidil." How would I know, right? This is the problem with healthcare. In fact, when we launched our vaccination services, we reached out to several of our customers, and they said, "We're interested. We like your company. We like your brand, but how often are we supposed to do flu shots? You know, what are we supposed to do?" Customers simply don't know, and we think that's money left on the table, right? So what we want to do is outreach and education, use the application to push services out that they don't know about to create a broader depth and breadth of medical services. So I'm going to end it with a little bit of a human aspect. Because of technology, because of our ability to do high volume and low transaction costs, because we don't have the overhead of brick and mortar stores, we're able to pay very well. Our top therapists earn over 70,000 pesos a month. Our top nurses over 100,000 pesos, right? These are self-submitted photos of our providers. They get to choose their hours. They go online when they want, very much like a Grab. They go offline, so they're often on vacation. So they take photos, and actually you see in the scuba shot, that's a Xenia uniform, and actually in the cliff shot, also a Xenia uniform. They do this as a tribute. They love the company, they love the brand, and they do this on their own because they're empowered and earning.